Welcome to the Philips Virtual HIMSS Learning Zone. I'm delighted to introduce our presentation about the 2020 Future Health Index titled The Age of Opportunity, Empowering the Next Generation to Transform Healthcare. Please join me in providing a warm welcome to our speakers for this session, Jan Kimpe, Chief Medical Officer at Philips, and Weiling Zhang, Head of Medical Office Connected Care at Philips. With that, I would like to give the floor to Jan Kimpe.
Thank you very much. Hello, everybody. It's a great pleasure to be here today with you and talk about our 2020 edition of the Future Health Index, which is completely focused on the young generation of healthcare professionals. And let me start with thanking my colleague, Weiling Zhang, who is the Chief Medical Officer for Connected Care, one of the business clusters at Philips, and she will join me on the call to give us the real world perspective.
Yeah, now, great to hear.
Thank you very much, Weiling. Now, for me to move the needle in healthcare, it is very important that we understand our customers very well, that we understand the experiences of those who are working in the healthcare, and that we understand our patients. As I have said in the beginning, we will focus this year on the young healthcare professionals, all of them younger than 40 years old, nurses as well as doctors. We are now in our 5th year of the Future Health Index, and the report we will be discussing today is the 2020 report. It is the result of a big survey, the biggest of its kind, in fact, that was sent to a large number of young healthcare professionals, and we have responses from almost 3,000 younger healthcare professionals, young healthcare nurses, young doctors, out of 15 countries. This is the generation that we will depend on for delivering care in the future. They are very, very important for our healthcare system. And if we don't start listening to them now, to these young healthcare professionals, we run the risk of losing them for our care altogether. The reason why we focused on this younger population of healthcare professionals in this edition of the Future Health Index is because we realize that they are met with enormous challenges. They see a growing global population, an increased life expectancy, and with that goes an emergence of multiple chronic diseases. And what we have seen over the give or take last 10 years is an increased rate of physician burnout and nurses burnout in the healthcare ecosystem. So that was the basic reason why we thought, let's go for this population and see how their experiences are, how they are engaged with digital solutions that are increasingly important in the healthcare ecosystem, and how they see their ideal work environment in the future. So going into the Future Health Index itself, we came up with like 3 central themes, or the results pointed us to 3 central themes, which is a better way of saying this. First of all, we wanted to explore the gaps between healthcare education, healthcare training, and what is happening in the world of these young healthcare professionals real time. Second, we wanted to explore how technology was helping them to transform healthcare in these challenging times. And finally, the third theme is a deep dive into the healthcare working environment that they see ideal for them to stay in the healthcare and to be passionate about it at the end still of their career, the same passion that they felt in the beginning of their career. So let's dive into these 3 big items one by one. And first, go over the exploration of the gaps in the healthcare education and the healthcare training in relation to the real work when they enter their profession. And we see these gaps in 4 areas. First of all, we have a skills gap. almost half of the young healthcare professionals, 44% globally, that is over all the 15 countries, feel that their medical education did not prepare them well for a big part of their daily work, especially the business and the administration tasks that they have to do. The second gap we found in this survey, in the analysis of this survey, is a knowledge gap. While everybody in the healthcare system nowadays is talking about value-based care, is talking about new payment models, is talking about new reimbursement models, only 20% of the young health professionals that we surveyed had a rather extensive understanding of what value-based care is. 78% of them did not know at all what value-based care means, or had only a very little understanding of it. The third gap we saw was a gap in data, and I would say in understanding how data can help them in their day-to-day work. 35% of the respondents say that they were overwhelmed by the amount of digital patient data, and 35% don't know how to use these data in daily clinical care. And the last gap and for me, that is the most important one, because it's in my opinion, very, very impactful, is the expectation gap. 40%, 41% to be exact, did not feel that their careers that they were living in now matched with the hopes and expectations they had when they were still students and still enjoying the education. Now, this is a very brief summary of the results that come into the first theme, the gap analysis. And now I would very much like to go into a dialogue for a few minutes with Willing to see if she recognized this coming from the healthcare world herself. So Willing, how do you think we can help younger healthcare professionals be better prepared for the non-clinical aspects of their job?
Yeah, great question, Yang. So a couple of areas I think we can help. The younger generation here have spoke out loud and clear that their education and the knowledge did not prepare them well for the real world of the practice. So I think this is a powerful feedback to the medical schools in their curriculum design, that they need to evolve over time and to incorporate more education and skill set trainings to evolve and to incorporate the newer trend for them to get better prepared. The other area that I think we can help is the enhanced residency and the fellowship training as well. So the teaching hospitals can evolve more for the younger generation to participate in those operational, financial, and strategic planning sessions for them to gain real-time experience.
So Willing, maybe a follow-up question on this. Do you see a role for technology companies as ourselves, as Philips, to help the educational community in this?
Yeah, technology can always play a role. I think that we can help build the platform in providing those training education sessions, but also that we can help build the technology in the day-to-day workflow in the hospital and the care delivery side as well, to make their work easier, and also that to guide them through of what really the value-based care is about.
Mm-hmm. On the second gap that we discovered during this survey is the gap on their knowledge on value-based care. Do you recognize this, and is there a way that we as an industry can help them understand this better?
Yeah, another great question. I think that the overall industry for the value-based care, there's still some myths about that. The overall complexity and the limited scalability of the current value-based care models and the various degree of the adoption from the payers on the payment models all contribute to this knowledge gap, just not only to the younger generation, but in general to the provider society as well. So currently, there's no industry standard playbook on value-based care of how to really do this. And the VBC reimbursement models in limited scales as well. Now, many payers in North America are moving a sizable portion of their payment to be value-based instead of volume-based. That is very encouraging. So such as CMS, they are doing value-based purchasing contracts, accountable care organizations, and bundle payments, etc. And many commercial payers are either following this or creating on their own. So once the major payers are aligned, increase their scale, and the healthcare provider industry simplifies the care delivery models surrounding around the value-based care, I think we'll see a wider adoption, a more standard playbook and best practice around it. At that time, that we'll see enhanced, and together with enhanced medical education, we'll see increased awareness and adoption from both the younger generation and the healthcare provider society in overall.
That are great insights, and I think you are right. This is this is in flux. This is almost changing on a daily basis. The reimbursement, the value-based care being embedded in the day-to-day way of working in the hospitals. So we should probably be banking more on continuous education on this than depending only on what they learn on value-based care in school. Thank you very much for these insights. So let's move to the second theme, and that has to do with harnessing technology to help transform healthcare. Out of the survey, we learned that young healthcare professionals, nurses and doctors less than 40 years old, who just entered their daily work in the clinic or in the healthcare ecosystem, they have a sort of love-hate relationship with digital solutions. At the one hand, and that is the love side, they are deeply convinced that digital health technologies are an important tool to achieve better patient outcomes. 79% gave that answer in the survey. 47% found that digital health technologies will improve patient experiences. And 81% found that the right technologies have the potential also to induce their own workload. So that is the positive side. We have really believers here in that, in this young healthcare professional group, believers in the digital health technologies. But on the other side, and then we move to the hate part of this equilibrium, they see that dealing with patient data and sharing patient data gives them still a lot of trouble. 64% feel that the sharing restrictions that are still present in almost all the countries that we measured in this, or that we surveyed in this study, have caused still an incomplete sharing of patient data. So there are so many restrictions that there is some information lost in the handover from one doctor to the other in the same hospital, between hospitals, and for sure if you have to share data on an international scale. Half of them, 53%, did not have enough digital patient data and experience with that to influence patient outcomes. And the worst part of this item, of the analysis of this item, was that between 33% and 39% found that the data that are available to them aren't relevant or aren't actionable, don't help them in their decision making. Reeling, you wrote a very interesting blog on LinkedIn recently, that we have to, you didn't say that directly, but it was a little bit close to that notion that we have to stop talking and start implementing all these digital solutions. Can you elaborate on this a little bit longer and reflect on what you said in the blog to the results we got from this survey?
Sure. So I think the healthcare providers in relationship with the data and the data insight in a paradigm. So in one side, they feel that they get too much data. It's very overwhelming, and they don't know what to do about this. On the other side, that they feel that they're craving for insightful, actionable data. They still don't think they're getting enough of those. So I think in terms of what we can learn from a healthcare digital company, a few things that we need to improve to help the healthcare providers society. One is the data sharing and interoperability. So if we can make the data connected and flow from setting to setting in a simple and easy way, so they can see the information when they transfer a patient from one setting to the other, that will help with their daily work. The other area is we need to pay attention to meaningful and actionable data insight. So for the AI technologies and the predictive data models, if we can generate the insights that the providers can do something about it to drive and improve the real-time decision-making, that will help with the daily workflow. The third thing is actually incorporate all these data insights into the workflow, and better yet, if we can automate this into the workflow. So this can, the technology can alleviate their work burden and not add to those. So all this, I think that will help them to transform the care along the way, and we should do something about it.
Could you give your idea on who should be the owner for this? Because it is clear that we have to deal with interoperability and we have to make data sharing more effective so that it really helps these young doctors in their daily life. But who is going to own this? Who is going to drive this?
Yeah, it's probably a collaborative work between many different parties. The regulators, they need to look at the rules and regulations of how they are determining what and how we can share and we cannot share, and the ways we can or cannot do. The technology companies can play a huge role in setting the platform, in setting the technology to make it happen, and the adoption from the provider side and even the buy-in from the patient side. All this would contribute to this. But I would think that the driving part at the starting point will be the regulators in looking at their regulations to ease and evolve some of the regulation to keep up with today's trend and the needs, and for the technology company to come up with the easy, doable, and innovative solutions to make it happen.
This is great. So you recognize, or you point out to us, that nobody can do it alone. We have to work together to make this happen in the future. So everybody talks about AI, artificial intelligence, and also these young healthcare professionals are enthusiastic about the idea, not because of AI itself, but because how it can be integrated in the digital tools so that they can be more effective and more enabling. What other technologies than AI do you see playing a role in transforming healthcare in the future?
Sure, I think that anything can increase the connection between humans, especially between the patient and the providers, or even among the providers themselves. will create convenience, flexibility, and enhance the experience will play a role and will help. So, for example, the telemedicine is a relatively newer trend, and it's creating the convenience, scalability in the provider side. And even in today's COVID-19 pandemic, this is providing a safer and more convenient alternative care delivery model than for the infected patient to go to a hospital, which is already get overburdened from all the incoming demand. Even in the Felix example, for example, like tele ICU, we're creating a scale in a remote site that can be a complementary to the bedside delivery of ICU to providing safer and more insightful care in complementary to the bedside. And our remote patient monitoring technology can effectively manage the chronic disease at scale while patient is still at home. So all this is creating convenience and flexibility while providing care at efficiency and at scale.
Fantastic. Let's move into the third theme and the last theme of results that came out of the Future Health Index 2020, which we focus completely on the young healthcare professionals. And that is related to the work environment they would feel happy in, they would feel comfortable in. But before we go into that work environment, let's look at the few very impactful figures. 74% of these young healthcare professionals experience regularly work-related stress. And 1/3 of them, a little bit more nurses than doctors, have considered leaving the healthcare profession as a result of this work-related stress. And this is, if this would happen in real time, this would impact the delivery of care enormously. We all can see that. Now, if you look at the hospitals that these young people want to work in, these hospitals are to want to work in most happily, so to speak, would be hospitals that we would call smart. And we made a categorization of the hospitals based on how integrated the digital solutions were with the human-to-human delivery of care, human-to-human contact. And we considered smart hospitals where the patient journey and the flow of a patient through a hospital, where they engage and interact with doctors and nurses, when this is integrated completely with the digital solutions, we would call this a smart hospital. And we see that 85% of the young health professionals working in these smart hospitals are happy to be in that hospital and satisfied with their work environment. If you go to the other hand, to analog hospitals, where a lot of the communication between healthcare professionals and patients is still on paper, where digital tools are fragmented or clunky, we call that analog hospitals. And here you see that 15% less of the young healthcare professionals, 71%, is happy in these environments. So one of the environment characteristics that young health professionals are looking for and choosing for is hospitals where human interaction and digital solution are as much integrated in the workflow as possible. Now, and then what would be other aspects of this working environment that they are looking out for? First of all, that would, next to being smart, as we discussed on the previous slide, it would be hospitals that foster an atmosphere of collaboration. Young healthcare professionals want to work in teams, want to work together, want to be in multidisciplinary teams. The third one would be flexibility. They want a flexible work environment. They want a work environment that fits better in a good work-life balance. Maybe even they want to make, for example, their rosters and the time they work and time they are free, they want to make their rosters themselves instead of having them imposed on them by their leaders. So although salary is still a big factor in their satisfaction with their work, these other factors as collaboration, autonomy, flexibility, and a smart work environment are increasingly important in their choices for a certain hospital and in their willingness to stay in the healthcare sector altogether. So let's go for the last time to you, Wheeling, and see what your reflections would be. What are the connected care features in these smarter hospitals that are making life easier for the younger healthcare professionals who work within them?
Sure. So I think that the technologies can alleviate the care providers' burden and not adding to it, and make the technologies connect with each other and make the care flow all going to help for them to feel more satisfied with their work. So if the technology can be incorporated seamlessly into the workflow, a couple of the examples that I can think of from the Connect Care side. One is we're not only making the monitor, but we're making the smart monitor. So we're incorporating the AI and the technology to create the early warning scores. So when you see the patient and monitoring the patient, and if any deterioration might be happening in the near future of the patient, and the early warning score will pop up on the screen. So as a care provider, you can see it, you can prioritize your workflow, and you can attend to this before it gets worse. So I think this is one of the examples that we can help the providers to plan their work a bit better ahead of time. The second one is the second example I can think of is we are creating those clinical operational centers within hospital. So moving the care or incorporating the care from the bedside, but into a central location as well. So this is coupled by the data insights, by the operational efficiency, and tells the providers where you can move the patient to what kind of setting, whether they're going to get ready, and when they might be ready. So you can plan the bed capacity, the readiness of the transfer, and the readiness of the treatment accordingly as well. So we have many examples. I don't think we have time to address all of them, but the common theme is that if we can create more connectivity in the workflow and help the providers to ease their work burden, all this is going to contribute to the work environment satisfaction.
Thank you very much, Wheeling, and thanks once again for engaging with me in this dialogue. So let's summarize the findings and especially the things that we can do for these young health professionals at the end of this seminar. We have made clear that the challenges that are facing these young healthcare professionals are huge, and we are standing at a crossroad. Now it is time to transform the healthcare system, and because these young health professionals are the ones that are going to transform the healthcare system, it is good to listen to them now. Otherwise, we will lose them on the road much earlier than we can miss them. So what would be the recommendations for the industry or from the industry to prepare these people better for their work and make sure that if they have entered the work, they stay there? First of all, it's on the level of education and training. We have to increase the focus during their education on administrative and business management to ensure younger healthcare professionals are prepared for this side of their role. Then we have to provide appropriate training on the use and interpretation of technology and of data to ensure that it is maximized to its full potential. And we have to help them understand the principles of value-based care, and not only during their training, but during a continuous education effort, because this value-based care paradigm is not happening overnight. It is slowly implemented and deployed in the different healthcare systems all over the world. Now, on the technology part, we have to invest in data sharing technologies to make the data and the data sharing more usable. We have to harness technology to improve both work-life balance as well as clinical performance and patient experience improvement. And we have to work with payers to increase pressure on the industry to deliver greater product interoperability. And lastly, on the culture part, we have to examine the decision-making hierarchy and the process to ensure that opinions of younger healthcare professionals are acknowledged and are acted upon. Listen to them in order not to lose them. We have to encourage younger healthcare professionals to become involved in the operational side of hospital practices. And we have to enable flexible working through staggered shift patterns and maybe giving the responsibility to make the shifts or to design the shift patterns. Let that be done by the young healthcare professionals themselves. And we have to leverage technology to minimize stress and burnout. So this was a short summary of the actions we can take from tomorrow onwards. Thank you very much for joining Willing Zhang, medical leader of the Connected Care cluster in Philips, and myself today in this webinar. This has only been a snippet of what is discovered in the research, and I encourage you to download our global report and follow our discussions by joining in the conversations online using #FutureHealth. I turn it over to Bart to close this session.
Thank you very much, both to Jan Kimpen and Wei-Ling Zhang for this great session. To find out more Philips Virtual HIMSS Learning Zone presentations, please visit the Philips at HIMSS 2020 homepage. Thank you.